If you've ever dealt with a serious illness, you've probably heard well-meaning friends tell you to just stay positive. It sounds nice in theory, but to a patient, it often feels dismissive, as if confidence is a fleeting mood with no bearing on the physical reality of a disease. But clinical data reveals a strange anomaly. When oncologists track patients with identical medical diagnoses, those suffering from severe depression often experience a faster physical decline than those who maintain a strong sense of optimism. This correlation is the foundation of psychoneuroimmunology, or PNI. It's a scientific discipline that maps the continuous two-way communication network between the brain and the immune system. Thoughts and emotions function as physical commands, dictating how our biology defends itself. Chronic doubt and despair register in the brain as a continuous physical threat. A danger signal cascades down the HPA axis to the adrenal glands, flooding the bloodstream with cortisol and adrenaline. Over time, this constant hormonal flood suppresses the production of critical defenders, specifically T cells and natural killer cells, leaving the patient vulnerable to disease progression. We see the extreme end of this mechanism in the nocebo effect. If a patient is simply told that a chemotherapy drug will cause severe pain or nausea, their expectation of that suffering can cause those exact physical symptoms to manifest, even if they are given an inert placebo. The anxiety triggers the brain to release inflammatory messenger proteins, like interleukin-6. These proteins act as distress signals that induce a state of physical malaise and deep, crippling fatigue, essentially creating exhaustion out of thin air. A mind weighed down by persistent fear engages physiological pathways that disarm the body's anti-cancer defenses, eroding physical momentum and manufacturing exhaustion. Shifting a patient toward feelings of agency and hope triggers a completely different physiological cascade. When a patient feels confident in their treatment plan, their body pulls out of the chronic stress of fight or flight and enters a restorative fight or heal biological state. Researchers tested this by putting patients with early-stage breast cancer through cognitive behavioral therapy and guided relaxation. The women were taught to visualize their immune system destroying cancer cells. This chart compares the immune profiles of the two groups, showing measurable spikes in both the total count of active T lymphocytes and the actual toxicity of natural killer cells in the patients who practiced the guided imagery. By lowering their stress hormones, these patients removed the biochemical interference that usually blocks immune function. Their white blood cells were allowed to operate at maximum efficiency. These immunological shifts align with the long-held observations of psychosomatic medicine. Clinicians like Dr. Bernie Siegel suggested decades ago that a patient's mental state directly influences their disease course. Confidence acts as a biological catalyst. It dials down systemic inflammation and stress, restoring physical energy so the body can focus its resources on recovery. Confidence is built through active agency, like physical rehabilitation to regain strength, mindfulness to stay grounded, and meaning-centered therapy to find a personal reason to keep fighting. These tangible actions lower the systemic burden on the body. They pull the patient out of isolation and create a virtuous biological cycle where reduced inflammation leads to better sleep and sustained energy. Actively managing a patient's psychological state literally alters the biological terrain where the entire battle against disease occurs.